Jackie Hodges. I'm a health educator. There was a gentleman who came to City Council, and he was concerned about the health of his two twin daughters, and he wanted to be able to go out to eat here in the community, but found himself going to other cities, other places because of the smoke. So he asked City Council that they consider making the city smoke-free.
I'm Dr. Eugene H. Shavely. I'm a general surgeon in Campbellsville, Kentucky. Tobacco smoking is the leading cause of cancer death in Taylor County and throughout the state. It's a tremendous health problem. We have the highest rate of cancer in the United States. I have a very high smoking rate. I think it's about 25 or 30%. And we see cancer patients every day. Most of the patients, when we see them, have metastatic disease, and we can prolong their life, but we can't really cure them.
I'm David Nunnery. I'm an attorney in Campbellsville, Kentucky. A local citizen approached me one time and called and wanted to know if we could pursue, at the City Council, if we could pursue an ordinance for a smoke-free community. And I suggested to him that I would be in favor of that, but that if he thought it was a good idea, he or someone from the community should come and speak to the City Council, because that would be more likely to get their attention. He did, and there was interest. There was also opposition, so eventually we developed an ordinance and had a lot of debate about what should be in it, but eventually did adopt an ordinance.
Tim Hazlett, welcome to the Campbellsville, Kentucky Police Department. Enacted a smoking ban ordinance approximately 6 years ago, and it's been in place now for that period of time. And in the past 2.5 years, during my tenure here, we haven't encountered any issues. It seems as though in visiting local restaurants and places of business that it's been embraced by the community as a positive enactment, and there have been no complaints about any violations of it. We have not taken any police actions with regard to the enforcement of this ordinance during these past 31 months. So I believe that if it's properly presented, and I think that folks are more socially accepting of these segregated activities with regard to smoking and non-smoking designations, and it seems to be something that's believed to help not only from the health side but from the economic development side. That there's not a tendency for patrons to go to other establishments because of smoke, so it's worked pretty well.
Well, the health department served as a liaison between a lot of different organizations, I guess. We helped provide educational packets. We helped coordinate the University of Kentucky, and they played a large role in it. So we connected them with the American Heart Association and brought them to the local level. We used our facilities for press conferences and things of that nature. So, the community, City Council, they did all the work, but we were able to connect all those pieces together.
Awareness and plenty of public input, but the stage has been set nationally and statewide that it's to enact a prohibition like that is not a shock any longer, like it was 20 years ago. When it was, that was new. That was a new venture for most communities, and you had a heavier smoking population. The fact that tobacco is not the main agricultural crop now in Kentucky, that's another a dynamic.
If you've got an advocate in your community, those are the champions that you want to bring in. The tobacco-free, the smoke-free initiatives are definitely part of the health department's mission, but it takes those community voices, those local people, to just speak up and say, look, we're concerned about this. We want to see a change in our community. And we are definitely there to help provide resources and, to support those individuals. But, it doesn't necessarily have to be us on the front lines.